Cestodes, Cestode, phylum Platyhelminthes, class Cestoda, Cestode, tapeworm. General Cestode, introduction, classification, general characters, life cycle, metacestode, general character of cestode. General characters of cestode. Cestoda contain two subclasses, Eucystoda, true cestode, and Cotyloda, fish tapeworm. Worms are like ribbon or tape, hence called tapeworm. Body dorsoventrally flattened, ribbon-like, metamerically segmented. General characters of cestodes. General characters of cestode: body cavity and alimentary canals absent. Outer body covering called tegument. General body surface is absorptive and help in nutrient absorbance. General characters of cestodes. General characters of cestode: body of adult tapeworm consists of first scolex or head, second neck, third strobilia. Body consists of a head, example scolex, bearing hold fast organ or sucker, then unsegmented neck followed by strobila which consist of immature reproductive system and egg are absent. Mature reproductive organs are mature and functional, and gravid segment of proglotid reproductive organ degenerate and filled with egg. General characters of cestodes. General characters of cestodes. In Eucystoda, scolex is normally provided with four sucker which may be armed with hooks. The scolex usually bears anteriorly a mobile protorsival rostrum which may be also armed with one or more concentric row of hooks. In Cotyloda, the scolex has narrow, deep, weakly spatula-shaped muscular groove known as bothria as hold fast organ instead of suckers. General characters of cestodes. After shedding of gravid segment, the egg are set free either by distinction of the gravid proglotid apophysis or through an opening called thysenus. Thysenus. Thysenus, which created in the uterus due to the pressure of eggs and the muscular activity of proglotid. In the cotyloda, the eggs are normally continuously discharged from the proglotid through a uterine pore and not by apolysis. General characters of cestodes. However, when egg production has saged chain of exhausted proglotid may be detached from the strobila pseudo-apolysis. Hermaphrodite example: each major proglotid contain one or two set of male and female reproductive organs. General characters of cestode. Excretory system consists of phlegm cell, solenocyte, and efferent canal and discharge nutrient at the terminal segment. Cestode eggs may be embryonated or unembryonated when passed from the host, and the fully embryonated egg contain an oncosphere. Oncosphere is bilaterally symmetrical, spherical or oval, and is armed with three pair of hooks. In Cotyloda, egg hatch in the environment, whereas in Eucystoda, egg hatch after being ingested by intermediate host. Metacystodes. Metacystode. Larval stage of cystode is called metacystode or bladder worm. Different metacystodes. Tetrathyridium is an elongated solid body metacystodes with deeply invaginated acetabular scolex. Mesocystode cysticercoid is single non invaginated scolex embedded in a small solid vesicle. Example Diphylidium caninum. Types of metacystode. Types of metacystode. Cysticercus is fluid-filled bladder contain an attached single invaginated scolex. Example Tinea saginata, Tinea solium, Tinea pisciformis, etc. Cinerus is a large fluid containing bladder with a number of invaginated scolex attached to the valve. Example Tinea multiceps. Type of metacystode. Types of metacystode. Strobilocircus has a scolex which is not invaginated when fully developed and is attached to the bladder by a long segmented strobila. Example Tinea formis. Hydrated cyst is a thick walled, large sized fluid containing bladder with a number of broad capsules inside it, and each broad capsule contains a number of scoleaces. Example Echinococcus granulosus. Type of metacystodes. Procercoid is first larval stage of Diphyllobothridium latum, occurs in the first intermediate host, Cyclops. It is solid body and bears 6 hooks on the sarcomere in the posterior region. 6 hook. Plerocercoid is second larval stage and Diphyllobothridium latum occurs in the second intermediate host phase. Plerocercoids are elongated solid body metacystode which bear an adult scolex. Class Cestoda. 2 subtype Eucystoda. 2 typum. Order Cyclophylidae. Cotyloda. Pseudotapeworm. Order Pseudophylidae. Characters. Scolex has 2 narrow deep groove called bothria. Has 4 sucker which may be armed with hooks. Genital pore found on ventral surface. Marginal except mesocystoids where it is on mid-ventral surface. Egg operculated and embryonated and non-operculated. Intermediate host. Required 2 intermediate hosts. Required 1 intermediate host except mesocystoids. Family genus Diphyllobothridium spirometra. Anoplocephalidae. Anoplocephala. Monisia. Stylacia. Avitelina. Thysanosoma. Dilepidi. Diphylidium. Amoebotinia. Conotinia. Davinia. Relitina. Cotugnia. Tenidi. Tinea echinococcus. Hymenolipdidae. Hymenolapsis. Mesocystoides. Equine tapeworm. Anoplocephala. Paranoplocephala family Anoplocephalidae family Anoplocephalidae Anoplocephalidae members have neither rostrum nor hook. Segments are wider than long. Uterus persists as transverse or may be replaced by a capsule or peruterine organ. 4-year shaped lappets present behind the sucker in case of a perfoliata. Egg has 3-layer covering, outermost vitelline membrane, middle albuminous coat, and inner chitinous membrane, which is frequently pear-shaped, bearing one side a pair of hooks projection called piriform apparatus. Family Anoplocephalidae. Family Anoplocephalidae. Type of metacestode. 60 sarcoids. Intermediate host orbited mites. Genus Anoplocephala. Monesia. Stylacia avitellina. Thysanosoma. Genus Anoplocephala. Genus Anoplocephala. Genus Anoplocephala. Species. Morphological character. Final host. Intermediate host. Location. Anoplocephala perfoliata. Length up to 8 cm for lappet in the scolex. One lappet behind is sucker, horse and donkey. Small intestine. Anoplocephala magna. Length up to 80 cm. Lappet absent. Horse, donkey, mite. Small intestine. Paranoplocephala mammillana. Smallest equine tapeworm. Sucker are still like lappet absent. Horse. Small intestine, occasionally stomach. Life cycle of Anoplocephala. Life cycle of Anoplocephala. First, grazing horse. Injection mite infected with 60 sarcoid. Genus Anoplocephala. Genus Anoplocephala. Pathogenesis. Light infection are mostly asymptomatic, but very large number of infection may cause ill health, unthriftiness, and even death. A perfoliata, most common intestinal tapeworm of horses in the world, and is one of the tape causes of equine colic, mostly found in the ileocecal junction, where produce inflammation, ulceration, formation of granulation tissue, and oedema which may partially occlude the ileocecal opening. A magna in heavy infection, it produces catarrhal or hemorrhagic enteritis and perforation of intestine. Paranoplocephala mammillana, seldom responsible for ill health. Genus Anoplocephala. Diagnosis. On the basis of finding of eggs with piriform apparatus and gravid segment in the feces. Piriform apparatus. Treatment. Bithionol 10 mg per kg body weight orally. Mebendazole 50 mg kg body weight orally. Nicosamide 90 mg per kg body weight orally. Arecanetas 30 to 45 gram in empty stomach. Ivermectin or moxidectin in combination with praziquantel are extremely effective against this parasite control through regular deworming. Ruminant tapeworm. Ruminant tapeworm. Ruminant tapeworm. Monisia, Stylacia, Avitelina, Thysanosoma. Genus Monisia. Genus Monisia. Morphological characters. Scolex is provided with only unarmed for prominent sucker. Scolex has neither rostrum nor hook. Segments are broader than longer. Largest tapeworm of ruminant. Each segment has two sets of genital organ. Genus Monisia. Genus Monisia. Species of Monisia. Species define host, definitive host, location, intermediate host, type of metacestode. Monisia expansa, sheep tapeworm or double pored ruminant tapeworm. Sheep and goat chiefly and cattle, small intestine, orbited mite, galumina, oribatula, etc. 60 sarcoids. Monisia benedeni, cattle, Sam. Genus Monisia. Structure Monisia expansa, Monisia benedeni. Interproglotidal gland, ring shape, rosette like. Interproglotidal gland are extending along the full breadth of the proglottid. Band like. Interproglotid gland are confined to a short continuous row in the middle the proglottid. A triangular in shape with well developed piriform apparatus. Square in shape with developed piriform apparatus. Monisia expansa, interproglottid gland. Monisia benedeni. Genus Monisia. Life cycle. Gravid segments are passed in the feces of affected animal. Egg release after disintegration of gravid segment. Egg are ingested by orbitated mite intermediate host. 60 sarcoid developed in the body cavity. Final host get infection by the ingestion of 60 sarcoid infected mite during grazing. Adult Monisia species are developed after 5-6 weeks after infection. Pathogenesis. Although infection may occur in animals of any age, but it is more common in young animals than adults. Monisia species infection is usually common in young animals under 6 months of age. These tapeworms are less pathogenic, maybe due to their unarmed scolex. Heavy infection can cause digestive disturbance, diarrhea, emaciation, anemia, stunning growth, unthriftiness, pot-bellied, obstruction of the intestine, etc. Genus Monisia. Diagnosis. Finding of gravid proglottid looking like cooked rice grain in the feces of infected host. Microscopic detection of somewhat triangular shape Monisia expansa or square shape Monisia benedeni eggs with well developed piriform apparatus. Treatment niclosamide 100 mg per kg body weight. Praziquantel 3.75 mg per kg body weight. Albendazole 5 mg per kg body weight. Control treatment of the infection animal, plugging of the infected pasture to control orbited mite. Genus Stylacia. Genus Stylacia. Morphological characters. Scolex is provided with only unarmed four prominent sucker. Scolex has neither rostrum nor hook. Segments are broader than long. Each segment has one set of genital organ and genital pore alternate irregularly. Uterus is long, transverse and dumbbell shaped. Two uterine organs per gravid segment, and each uterine organ contain about 30 eggs. Oval-shaped eggs have no pyriform apparatus. Genus Stylacia. Species definitive host, location intermediate host, type of larva. Stylacia hepatica, liver tapeworm, sheep, goat, cattle, white ruminant, bile duct, orbatid mite, galumina, oribatula, etc. Cysticercoids. Stylacia globipunctada, same. Small intestine, same. Genus Stylacia. Paruterine organ. Pathogenesis. Stylacia hepatica, less pathogenic. Infected liver are condemned at meat inspection is the only major harm occurred. Stylacia globipunctada form nodules, proliferative inflammation, desquamation of epithelium of small intestine. Treatment: praziquantel 15 mg per kg body weight. Morphological characters: Scolex is provided with only unarmed four prominent suckers. Scolex has neither rostrum nor hook. Each segment has one set of genital organ and genital pore alternate irregularly. Uterus is transverse in the middle of proglottids. One uterine organs per gravid segment. Egg have no pyriform apparatus. Genus Avitelina. Parasite definitive host, location intermediate host, type of larva. Avitelina centripunctada, sheep, goat and other ruminant, small intestine. Shocopterus, insect like book lice, dust lice and bark lice. Cysticercoids. Avitelina. Thysanosoma actinoids. Common name: fringed tapeworm. Posterior border of segment is fringed papillated. Presence of several uterine organs. Each segment contains two sets of genital organ. Pyriform apparatus absent in egg. Thysanosoma actinoides. Species final host, location intermediate host, type of metacestode. Thysanosoma actinoids, sheep, cattle and deer, bile duct and pancreatic duct and small intestine. Cestodes, cysticercoids. Dog tapeworm first. Dog tapeworm. Diphyllidium tinea, Echinococcus. Family: Dileptidae. Dilepidae. General characters: Adult tapeworm found in bird and mammals. Retractile rostrum usually armed with one or two row of rose thorn-shaped hook. Genital organ one or two per segment. Uterus is sac-like or may be replaced by a capsule or a paruterine organ. Genus Diphyllidium caninum. Amoebotinia cornotinia. Diphyllidium caninum. Diphyllidium caninum. Common name Flea tapeworm or cucumber tapeworm or double pot tapeworm of dog. Definitive host or final host dog, cat, fox, and children. Intermediate host dog, fleas, dog fleas, Tinocephalides canis, Tinocephalides felis, and Pulex irritans, and dog louse, Trichodactyl canis. Type of larva metacystode. Cysticercoid in intermediate host. Predilection site small intestine. Family Dilepididae. Silent feature common tapeworm of dog. Scolex has a rostrum which has arm with 3 to 5 row of rose thorn shape. Irregular arrangement hook. Sucker are unarmed. Each segment has double set of genital organ with bilateral genital pore. Ovary and vitelline gland form a bunch of grapes on either side. Life cycle of Diphyllidium caninum. Gravid segment of Diphyllidium caninum are passed out with the feces of infected definitive host like dog etc. Gravid segment of D caninum are active and motile. During migration of craveling of gravid segments in perineal region or on floor, the egg are released from the gravid segment. Egg are ingested by fleas and lice, and oncosphere are released from the egg, and these migrate into the abdominal cavity and develop into cysticercoids. Life cycle of Diphyllidium caninum. Definitive host like dog get the infection by the injection of cysticercoid infected fleas or lice. Adult Diphyllidium caninum will be developed in the small intestine of definitive host 3 to 4 weeks after infection. Children get the infection of Diphyllidium caninum by accidental ingestion of infected flea or lice during playing with pet. Life cycle of Diphyllidium caninum. Diphyllidium caninum pathogenesis. Adults are usually non-pathogenic, but several infections may occur. Enteritis, mechanical obstruction of intestine, etc. Migration of gravid segments in the perineal region caused constant irritation resulting anal pruritus, dragging of anus on the ground. Diphyllidium caninum symptoms diarrhea or constipation, unthriftiness, abdominal pain, etc. Dragging of anus on the ground. Affected dog drag the anus over the ground because of anal pruritus due to gravid segmented calving. Nervous disorder due to absorption of the metabolites released by the D caninum. Diphyllidium caninum diagnosis on the basis of typical clinical sign like dragging anus over the ground or any hard object etc. By finding the gravid segment around perineal region of infected dog on the floor or beds etc. By microscopically detecting cucumber seed like gravid segment. Microscopic detection of 20 to 30 eggs containing a capsule in feces. Diphylidium caninum. Diphylidium caninum treatment. Praziquantel 10 mg per kg body weight and nicosamide 2 gram are effective against adult worm. Control treatment of the infected animal and man with anticestodal drug like praziquantel etc. By controlling the intermediate host flea and lice by using insecticidal drug like amitraz, cypermethrin etc. Family Tenidae. Family Tenidae. Morphological characters. Scolex has rostrum which armed with double row of hooks except Tinea saginata. Its segments are longer than broader. Genital pore alternate irregularly. Each segment has single set of genital organ. Egg are small brown in color, spherical shaped, containing an oncospore which is covered by a thick and readily striated embryophore. Difference between T. solium and T. saginata with respect to Scolex. Family Tenidae. Tenidae. Species definitive host, intermediate host, type of larva, location. Tinea saginata, man, cattle and other ruminant. 60 circus bovis found more in heart and masseter muscle of intermediate host. Adult worm in small intestine. Tinea solium, man, pig and man. 60 circus cellulose found in skeletal and cardiac muscle of pig, intermediate host. Adult worm in small intestine. Tinea multiceps, dog, sheep and goat. Cineras cerebralis, intermediate host. Tinea hydatigena, dog and wild carnivorous. Ruminant, particularly sheep. 60 circus tenulicolis found in peritoneal cavity of intermediate host sheep. Tinea ovis, dog. Tinea ovis, dog, sheep. 60 circus ovis in muscle. Echinococcus granulus, dog, domestic ruminant, pig and man. Hydatid cyst in lungs and liver. Tinea saginata. Tinea saginata. It is a zoonotic parasite and largest tapeworm of man. Adult Tinea saginata found in the small intestine of man, final host, whereas 60 circus bovis metacestode found usually in heart and masseter muscle of cattle, intermediate host. Scolex has neither rostrum nor hook. Man get infection by the ingestion of raw or undercooked 60 circus bovis infected measly beef. Cattle get infection by the ingestion of egg of Tinea saginata during grazing. Life cycle of Tinea saginata. Eggs and gravid segment of Tinea saginata are excreted from the infected man. Cattle get the infection by the ingestion of egg during grazing. Oncospore from the egg come out in the intestine and penetrate the intestinal wall with the help of their hooks. Through blood circulation, it spread throughout musculature and transform into larval stage. 60 circus bovis metacystody developed 10 to 12 weeks after infection. Men get the infection by the injection of raw or undercooked beef, measly beef. Adult Tinea saginata develop in the small intestine of man 2 3 months after infection. Tinea saginata pathogenesis. Infection in cattle is usually asymptomatic, but several infections may cause myositis, myocarditis with symptoms like heart failure, muscular stiffness, fever, etc. In men, adult worm may cause diarrhea, epigastric pain, etc. Epidemiology: infection is more common in underdeveloped and developing countries like India. Poor human hygiene and sanitation are responsible for the spreading of infection. Tinea saginata. Diagnosis: cattle, Cystocircus bovis, metacystode diagnosed in masseter muscle, heart, tongue, intercostal muscle, and diaphragm during meat inspection. Man, finding of gravid proglotid and egg in the feces or perineal region in adult cystode. Scolex has without rostellum. Tinea saginata. Treatment: drug is usually not highly effective against Cysticercus bovis. However, some drug like praziquantel quantel 50 mg per kg body weight orally can used. Praziquantel 10 mg per kg body weight and nicosamide 2 gram are effective against adult worm in man. Control: treatment of the infected man, proper refrigeration and cooking of beef, freezing at 10 degree Fahrenheit for 9 days and thermal temperature above 57 degrees Celsius will kill the metacystodes. Public education to increase awareness of hygiene and cooking, improving human sanitation, inspection of beef and proper disposal of human excreta are important measures. Prevent the grazing of infected pasture. Tinea solium. Tinea solium, commonly known as pork tapeworm, it is also a zoonotic parasite. Adult Tinea solium found in the small intestine of man, final host, whereas Cysticercus cellulosae metacystode found mainly in skeletal and cardiac muscle of pig, intermediate host. Scolex has rostellum which is armed with two rows of hooks. Life cycle of Tinea solium. Life cycle is similar to Tinea saginata except pig act as the intermediate host where larva stage Cysticercus cellulosae found mainly in skeletal and cardiac muscles of pig. Man also act as an intermediate host due to accidental injection of eggs through contaminated food or from dirty hand and due to autoinfection as a result of reverse peristalsis. Then metacystode develop in the brain, eye, subcutaneous tissue and other organs also. Morphological difference between Tinea solium and Tinea saginata. Character: Tinea solium and Tinea saginata. Rostellum and hooks present and armed with two rows of hooks is may absent. Length 3 to 5, rarely up to 8 meter, 4 to 8 meter, rarely up to 25 meter. Uterus of gravid segment ovary 7 to 40 lateral branches on either side, trilobes 50 to 30 lateral branches on each side, bilobed. Ovary trilobed, bilobed. Vaginal sphincter muscle absent, present. Gravid segment do not leave the host spontaneously. Leave the host spontaneously. Number of egg per segment 40,000, 80,000. Tinea species. Tinea saginata proglotid stand to show uterine branches. The pore on the side identifies it as a cyclophyllid cystode. Pathogenesis. Pathogenesis. Pathogenesis and symptoms depend on location and Number of adult or larval stage of the worm in the host. Larval stage of worm cause inapparent clinical sign in pig but in man. Larval stage cause various symptoms depending upon the location of the cyst like first, neurocysticercosis. If the cyst is developed in the CNS, which consists of neurological symptoms like epilepsy, paralysis, mental disturbance, etc. Ocular cysticercosis, when cysts develop in the eye, which lead loss of vision. Tinea solium diagnosis. Adult stage can be diagnosed by finding the egg and gravid segment in the feces or in the perianal area. Larval stage cysticercus cellulosis in pig can be diagnosed by meat inspection, whereas in man, larval stage diagnosed by MRI or CAT scan or by serological tests like ELISA enzyme linked immunosorbate assay and by molecular tests like PCR, polymerase chain reaction, etc. Tinea solium treatment. Drug is usually not highly effective against Cysticercus bovis. However, some drugs like praziquantel 50 mg per kg body weight orally can be used. Praziquantel 10 mg per kg body weight and nicosamide 2 gram are effective against adult worm in man. Control. Treatment of the infected man. Proper refrigeration and cooking of pork, freezing at -20 degrees Fahrenheit for 2 or more days, and cooking above 57 degrees Celsius will kill the metacestode in pork. Public education to increase awareness of hygiene, improving human sanitation. People should be careful to avoid foods that might be contaminated by human feces and avoid raw and inadequately cooked pork. Tinea multiceps. Adult worm found in the small intestine of dog, fox, jackal, etc. Final host, whereas Cynorus cerebralis metacestode found more in the brain and spinal cord of sheep, goat, and cattle. Intermediate host. Scolex has rostellum which armed with double row of 22 to 32 hooks. Uterus has 40 to 20 lateral branches on either side. Sheep and goat get infection by the ingestion of egg of Tinea multiceps during grazing. Final host, dog etc. get infection by the injection of Cynorus cerebralis. Life cycle of Tinea multiceps. Eggs and gravid segment of Tinea multiceps passed with feces of infected dog. Sheep and goat get the infection by the injection of egg during grazing. Oncospore from the egg come out in the intestine and penetrate the intestinal wall with the help of their hooks. Through blood circulation, it localized in the central nervous system or other body part of intermediate host. Cysticercus cerebralis metacestode become infective after 6 to 8 months after infection in intermediate host. Final host, dog etc. get infection by the injection of Cynorus cerebralis tissue. Life cycle of T. multiceps. Pathogenesis of T. multiceps. Infection is usually chronic in nature. The disease caused by the larval stage of T. multiceps is called GID or Stiggers. The symptoms of infection depend on the location of the cyst in the brain. If the cyst is located on the surface of the cerebral hemisphere in parietal region, which is common, then affected sheep or goat showing circling movement toward the affected side. If the cyst is present in the anterior part of the brain, then the affected animal keep the head on the chest and walk with a high step in a straight line until it meet an obstacle to remain motionless for a while and skull undergo pressure atrophy which can be felt by palpation. If cyst is in the cerebellum, the affected animal is hyper-aesthetic with jerky or staggering gait and become prostrate. Symptom of gait. Symptom of gait. Pathogenesis of gait. Pathogenesis of gait. If cyst is present in the spinal cord or affected sheep or goat, then hind leg become paralyzed. The above mentioned clinical symptoms may be intermittent, but if the condition persists, the affected sheep or goat become of it, prostrate and die due to emaciation. Diagnosis. Diagnosis of larval stage Cinerus cerebralis can be made by clinical sign, radiological examination, and also by postmortem. Treatment. Drug is not effective against cyst. Remove the cyst surgical is the best method. Echinococcus species. Adult Echinococcus granulosus found in the small intestine of dog. Final host and hydrated cyst mainly in liver and lungs of intermediate host. Scolex has rostellum which is armed with two rows of hooks. Adult worm usually contain 3 or 4 proglotid, rarely up to 6. Bilobed ovary is kindly shaped. Terminal segment is gravid and is usually about half of the total length of the worm. Gravid proglotid usually disintegrated in the intestine so that only eggs and not proglotid are found in the feces. Final host dog get the infection by the ingestion of hydrated cyst infected meat, whereas intermediate host get the infection by the ingestion of egg during grazing. Echinococcus species part was complete.